Getting pregnant. It might be exciting to become pregnant. Some people seem to be able to become pregnant just by talking about it. Others need time and probably a little luck to become pregnant. Getting pregnant may be easier if you know when you're most fertile. Simple do's and don'ts for conception should be taken into account as well. For instance, keep a healthy weight and engage in regular intercourse, particularly close to ovulation. Don't consume alcohol or smoke. Naturally, good sperm also counts. Healthy sperm will be discussed towards the end of this video. Most healthy couples become pregnant within a year of engaging in regular, unprotected intercourse. Do not attempt pregnancy on your own if you are having problems. You might be able to get assistance from a fertility expert or other medical professional. Men and women are both affected by infertility, and there is treatment available. How to conceive. Don't depend on chance if you want to get pregnant. Learn how to conceive, beginning with ovulation prediction and the do's and don'ts of boosting fertility. Ovulation prediction methods. The likelihood of conceiving can be increased by knowing when you ovulate and by engaging in regular intercourse 5 days prior to and on the day of ovulation. The process of an egg being released from the ovary is called ovulation. The egg is released and travels down the fallopian tube, where it remains for 12 to 24 hours before being fertilized. Under the correct circumstances, sperm can survive inside the female reproductive system for up to 5 days following sexual activity. Live sperm in the fallopian tubes during ovulation increase one's chances of getting pregnant. Ovulation usually happens around 14 days before to the beginning of the following menstrual period in a typical 28-day menstrual cycle. However, the duration of each person's cycle may differ, as well as the interval between ovulation and the beginning of the following menstrual cycle. If, like many individuals, your menstrual cycle isn't exactly 28 days long, you can use a menstrual calendar to track the duration and midway of your cycle. You can additionally search for ovulation symptoms and signals outside of the calendar, such as when vaginal secretions change. Your vaginal secretions may become more clear, moist, and stretchy right before ovulation. Cervical mucus thickens, becomes cloudier, and becomes less visible right after ovulation. When there is a change in core body temperature, the temperature of your body while at rest, basal body temperature, rises a little bit during ovulation. Every morning before you get out of bed, take your temperature with a thermometer that is specifically made to monitor basal body temperature. Keep a record of the outcomes, and keep an eye out for patterns. The 2 to 3 days before to the rise in body temperature are when you will be most fertile. An over-the-counter ovulation kit may also be something you want to try. It can assist you in determining the time of month when you are most likely to ovulate. The pre-ovulation hormone surge is detected by these kits in urine samples. A positive test is followed by ovulation in 36 hours or so. Causes of female fertility problems. Problems with female fertility can result from a number of medical conditions, such as 1. Ovulation abnormalities. This can interfere with the egg release from the ovaries. These include thyroid issues, polycystic ovarian syndrome, hyperprolactinemia, and other hormonal conditions, hyperthyroidism. 2. Abnormalities of the uterus or the cervical region, such as fibroids or polyps. 3. Inflammatory pelvic illness frequently results in fallopian tube damage or blockage. 4. When the tissue that normally lines the lining of the uterus begins to develop outside the uterus, it is known as endometriosis. 5. When the ovaries stop producing eggs and menstruation stops before age 40, this condition is known as primary ovarian insufficiency, early menopause. 6. Bands of scar tissue that bind organs together after surgery for the abdomen or pelvis, an appendicitis, or a pelvic infection, also known as pelvic adhesions. 7. Disorders like poorly managed diabetes, celiac disease, and various autoimmune diseases like lupus are among the illnesses linked to the absence of menstruation. 8. Another factor is age. Trying to delay pregnancy may make it more difficult for you to conceive. It becomes more challenging to get pregnant as you age because of a decrease in your egg supply and quality. How to increase fertility. What you should do. Follow these simple guidelines to conceive. Have sex frequently. Couples that engage in sexual activity daily or every other day have the highest likelihood of pregnancy. Have sex just before ovulation. Have intercourse every 2 to 3 days a week beginning shortly after the end of your period if having sex daily isn't possible or pleasurable. By doing this, you may make sure that you have intercourse at your most fertile time. Keep a healthy weight. Women who are overweight or underweight have a higher risk of developing ovulation problems. Additionally, think about discussing preconception planning with your healthcare practitioner. He or she will be able to evaluate your general health and assist you in identifying adjustments that could increase your chances of having a healthy pregnancy. Folic acid supplementation is recommended by your doctor a few months just before conception in order to lower the chance of spina bifida and other neural tube disorders. How to increase fertility. Things you should avoid. To increase your chances of getting pregnant. Avoid smoking. In addition to harming your overall health and the health of the fetus, smoking has other damaging consequences on fertility. Before you begin trying to conceive, ask your doctor for assistance in quitting smoking. Avoid consuming alcohol. Increased alcohol use may reduce fertility. In general, it's recommended to stay away from alcohol if you're trying to get pregnant. Limit caffeine. According to research, caffeine consumption of less than 200 milligrams per day has no effect on fertility. That equals about 1 to 2 cups of 6 to 8 ounce coffee per day. Avoid engaging in intense exercise in excess. Exercise that is difficult and intense for more than 5 hours per week has been linked to a reduction in ovulation. Avoid sexually transmitted diseases. Women's infertility is frequently brought on by infections like chlamydia and gonorrhea. Avoid working the night shift. Your risk of infertility may increase if you work the night shift frequently. This could be because it affects hormone production. If you do the night shift, make an effort to get enough sleep and rest while you aren't working. Even though stress won't prevent you from becoming pregnant, you should think about reducing stress and using healthy coping strategies, including relaxation techniques, when you're attempting to get pregnant. Finally, discuss any drugs you are taking with your doctor. It may be difficult to get pregnant while using some drugs, even over-the-counter ones. Men who are planning to father a child may wonder about the health of their sperm. Learn what can affect male fertility, then consider steps to help the sperm achieve its results. Healthy sperm. Sperm health depends on many factors, including quantity, movement, and structure. Quantity. Fertility is most likely if the semen discharged in a single ejaculation contains at least 15 million sperm per milliliter. Too little sperm in an ejaculation might make it more difficult to get pregnant because there are fewer candidates available to fertilize the egg. Movement. To reach and fertilize an egg, sperm must move swimming and wriggling through a female cervix, uterus, and fallopian tubes. This is known as motility. Pregnancy is possible with less than 40% of the sperm and ejaculate moving, but 40% is considered the threshold. The more the better. Structure. Typical sperm have oval heads and long tails, which work together to propel them. This is not as important a factor as sperm quantity or movement. What causes male fertility problems? Various medical issues can contribute to male fertility problems, including a problem in the hypothalamus or the pituitary gland, parts of the brain that signal the testicles to produce testosterone and sperm, secondary hypogonadism, testicular disease, sperm transport disorders. Age also can play a role. The ability of sperm to move and the number of typical sperm tend to decrease with age, affecting fertility, especially after age 50. What is the best way to produce healthy sperm? Simple steps to increase the chances of producing healthy sperm include: maintain a healthy weight. Some research suggests that increasing body mass index, BMI, is linked with decreasing sperm count and sperm movement. Eat a healthy diet. Choose plenty of fruits and vegetables, which are rich in antioxidants and might help improve sperm health. Prevent sexually transmitted infections, STIs. Sexually transmitted infections such as chlamydia and gonorrhea can cause infertility in men. Limiting the number of sexual partners and always using a condom for sex or staying in a mutually monogamous relationship with a partner who isn't infected can help guard against STIs. Manage stress. Stress can decrease sexual function and interfere with the hormones needed to produce sperm. Exercise. Moderate physical activity can increase levels of powerful antioxidant enzymes, which can help protect sperm. Take note of these. Sperm can be especially vulnerable to environmental factors, such as exposure to excessive heat or toxic chemicals. To protect fertility, don't smoke. Men who smoke cigarettes are more likely to have low sperm counts. If you smoke, ask your doctor to help you quit. Limit alcohol. Heavy drinking can lead to reduced testosterone production, impotence, and decreased sperm production. If you choose to drink, do so in moderation. For healthy adults, that means up to 1 drink a day for women and 2 drinks a day for men. Avoid lubricants during sex. While further research is needed on the effects of lubricants on fertility, consider avoiding lubricants during intercourse. If necessary, consider using mineral oil, canola oil, mustard oil, or a fertility-friendly lubricant, such as Pre-Seed. Talk to a healthcare provider about medications. Calcium channel blockers, tricyclic antidepressants, antiandrogens, opioids, and other medications can contribute to fertility issues. Anabolic steroids and other illicit drugs can have the same effect. Watch out for toxins. Exposure to pesticides, lead, and other toxins can affect sperm quantity and quality. If you must work with toxins, do so safely. For example, wear protective clothing, use protective equipment, such as safety goggles, and avoid skin contact with chemicals. Stay cool. Increased scrotal temperature can hamper sperm production. Although the benefits have not been fully proved, wearing loose-fitting underwear, reducing sitting, avoiding saunas and hot tubs, and limiting scrotum exposure to warm objects, such as a laptop, might enhance sperm quality. Chemotherapy and radiation therapy for cancer can impair sperm production and cause infertility that might be permanent. Ask a healthcare practitioner about the possibility of retrieving and storing sperm before treatment. When should I see a doctor? Adopting healthy lifestyle practices to promote fertility and avoiding things that can damage it can improve the chances of conceiving. The majority of healthy couples conceive within a year of having regular, unprotected sex. If you or your spouse have known or suspected fertility concerns, or you are 35 years of age or older as a woman, and have been trying to get pregnant for 6 months or above, you should think about seeing a doctor. Both men and women can have infertility, and there is available treatment. A gynecologist or your family doctor could be able to help, depending on the cause of the issue. The greatest hope in such circumstances is provided by a fertility expert. If this video was helpful, share it with someone. You could be saving a marriage by doing so. Don't forget to subscribe for more exciting videos. See you in my next video.